So here are the takeaways today that I'd like you to walk away with. I'd like you to understand the modules that are included in the Adaptivo software, understand the treatment machines currently supported, understand the basic capabilities of the INVIVO module, and understand the types of issues INVIVO can help identify, and then understand where Adaptivo fits in the radiation therapy process. And with that stated, let's talk about just a typical therapy workflow. I mean, this outlines just the basic steps. Today, with the complexity, there's even a few more items that you could actually put in this list. But everything starts with the basic simulation, some type of order, proceeds to treatment planning, and then pre-treatment QA, which a portion of Adaptivo will handle. You get the patient coming in for treatment. They'll get the daily imaging, image registration, patient setup, and treatment delivery. Pretty standard fare. So basically what we're going to talk about now is the after delivery, the assessment of what took place during that delivery, and then whether or not you potentially need to make any adjustments to your setup or go back to the simulator and potentially adapt the treatment plan. So like I'd mentioned, there are 3 modules in Adaptivo. We do have a pre-treatment module for doing pre-treatment QA for your IMRT plans, a daily 2D or INVIVO module, and a daily 3D adaptive, which I'll briefly cover in some of the slides here. So let's talk about the pre-treatment module. It uses the portal imager to verify plan delivery. It's an in-air measurement. So if you look at the image of the accelerator, this is basically you throw the panel out. The therapist can actually shoot this, and it basically collects the signal and compares it to a predicted measured signal. And you do get automatic notification of these results, and it does have a simple report that can be placed in the patient's chart with the results. Then I'm going to talk about the adaptive module here for just a second before we jump into INVIVO. So this is a daily and cumulative 3D dose analysis. It is using the daily cone beam CT, where we actually create essentially a merge image, and we deform the contours over to that merge image, and then basically calculate the dose. And you get a full set of DVHs that you can actually compare daily cumulative to the plan, a daily and cumulative dose review, and then there's some automatic analysis of the DVH based on Quantec, RTOG, or user-defined thresholds. And there's automatic notification of the any deviations based on those thresholds. And then there is a dashboard that has basically a full suite of tools that you can go in and analyze basically any of the results. So the INVIVO module, this is what we're going to spend most of our time on today. It does consist of a fully automated discovery and processing. So no manual steps once the software is set up and commissioned. Does use the portal imager. So this is a transit-based evaluation. So beam passes through the patient. We're not doing a back projection. This is actually using that transit information. It is the daily exit image tracking, and it's based on calibrated units. So you do need a calibrated panel, and you can monitor the beam during the delivery. We have a gamma analysis that is based on both a measured to predicted for the predicted, and then there's a relative mode that is a measured reference to a measured daily. And we're going to talk about this more in some following slides. We have a signed to gamma analysis, and we're going to go through exactly what that means, and then automatic notification of deviations, and then there's also reports that can be generated and exported to your R&V system. The INVIVO module does work as the diagram indicates for arcs or static fields. The treatment machines currently supported by Adaptivo are Varian, and it's the C-arm type machines with an electronic portal imaging device. So this would be your TrueBeams, TrueBeam Edge, your IX series, and your Trilogy machine. So then, what are the prerequisites and some of the benefits of the INVIVO QA module? So prerequisites are, you do need a calibrated EPID or electronic portal imaging device, and as indicated in the image, this is sort of the key to basically having a successful program. So that is absolutely key. With that, once the EPID is calibrated, a beam model is basically going to be constructed with a short commissioning process that takes 20 minutes if you have gold standard beam data, maybe up to 40 minutes of beam collection if we need to do a full collection due to the absence of the gold beam data from Varian. The software does require files from the TPS, like RT plan, RT structures, CT, etc. for a plan. But all of this information, once you are commissioned with the calibrated EPID and the beam model and the software is configured, all of this stuff is discovered automatically and retrieved and processed. So there's no manual export of information for each patient, anything like that. So then the benefit of this is it's actually a QA during the actual delivery. So this is transit, as I've mentioned before. And what the software is going to do, and we'll talk about this a little more in depth as we go through to sort of understand how this works, but it's essentially going to detect any path length, or what I'll say are effective path length changes. And with that, you can detect, things like patient alignment mismatch, what have you, anatomical changes, or for instance, if treatment is missing bolus or there's air where there shouldn't be. And we're going to talk a little more about this, but the goal is to basically help you verify that you have a correct delivery to the patient. And you can do this every day. You could do this on your first fraction only. I mean, the software is flexible. You can use it basically how your clinic chooses to. So then there are a couple of modes in the INVIVO module. The first one I'm going to talk about is the relative comparison mode. And it's just like it sounds. It's, again, using the portal imager. But what I've depicted here are treated fractions. And essentially, in the relative comparison, you're going to pick one of these fractions. Normally, the software is going to default to fraction 1. And basically, every other delivery is going to be compared to all the beams that are collected in fraction 1, which become the reference. And then subsequently, as those deliveries take place, it will compare to fraction 1. The trick with this is just making sure by checking your cone beam CTs, what have you, that your setup actually accurately represents your treatment plan. But once that is done, this will monitor the consistency of those beam deliveries across fractions, and we'll talk about some of that information in a few slides coming, where you get some temporal information, and it can really help you quickly identify when you've got changes to your patient that maybe you need to go investigate. And this also includes that sine to gamma analysis that I mentioned earlier, has a gamma matrix, which we're going to go through. These are pretty powerful tools to help you understand when there are changes that potentially require some action. Again, you do get the automatic notification of any deviations based on the user established thresholds. So this is sort of the key in the clinic, is establishing thresholds for your clinic that make sense with your patients. And then there are reports generated for the results that can be exported and imported into ARIA or any other clinical system. So then the module that we're going to spend the most time on today is the predicted module. So this is actually where the information is going to be based on the actual treatment plan. So this is with the commissioning measurements that I mentioned, with that 20 to 40 minute collection, and then the short commissioning process in our software. Basically, when the treatment plan is imported, pulled, you don't have to export this, but it's automatically pulled once a delivery is detected. The Adaptivo software is going to go through and it's going to predict what these portal images look like on the panel. So then each of your delivered fractions is going to be compared to that predicted portal image. And then any deviations, again, based on those thresholds that you set, will be automatically flagged, and you can get automatic notifications of that. And then you also have the sine gamma analysis with this, the gamma matrix that I talked about. And then just like the relative mode, you get automatic notification in the generation of reports. So then this is a snapshot of some of the pages when you come into a plan to analyze the plan in our software. You're going to get information like this. This is basically a plan that contains two beams, and this is an arc. And essentially you can see the results for fraction 1 with an average. And then I included a snapshot from the software where you can scroll across, and this includes fraction 6 through 10 with the average of 6 through 10. So what this does with this, what I call temporal information, because you can see fraction 1 all the way through fraction 5, and if you had 25 deliveries, you can scroll all the way across. It gives you information to determine whether any disagreements are basically in the same area. Are these things random or are they systematic? And are the areas of disagreement getting bigger or smaller? Are your gamma scores on this getting bigger or smaller? So with this, if you look at beam 2 in particular, you can see that sort of random between fractions 1 and 2, but then we start to pick up essentially a systematic, and in this case, this is a cold gamma, and we will talk more about what that means here in just a few minutes. But you can see that that area, if you go all the way across to fraction 5 and then the average, essentially what we do is take all the information from fractions 1 through 5, and this is configurable as well as far as how many fractions you would like included in your averages. It basically gives you an average result of that so that you can pick up on those systematic disagreements in that average result. And then you can also see whether or not that average result makes sense based on your individual daily fractions. Excuse me, my voice is kind of going there. But then if we look at fractions 6 through 10, you can see that there is a slight agreement to the pattern on the first arc, or beam 1, if you will. But we're seeing consistently this disagreement in this area. Even though these things are passing, this may be something that you want to go check out on your cone beam CT imaging, or if the therapists aren't imaging this particular area each day, you may want to ask for an imaging result so that you can go evaluate this area and then see what the disagreement is in that area and get a handle on the anatomical location of that. So one of the things in the software that's pretty powerful that goes along with this temporal information, I'm just going to pop back to this slide. So again, looking at this information across fractions is pretty powerful. You also get trending information. So this is for all beams. So this plan has essentially 4 arcs, and we're looking at the results for the predicted mode. So this is being compared directly to the treatment plan. And then we can also see the results for the relative mode, where it's being compared, in this case, to the first fractions delivered portals. And you can see that the trending information agrees quite well for both relative and predicted, which is a good indication. And the results are per fraction. So you can actually start to see when things are going to fall off the cliff a bit here. So through, I would say, fraction 18, 19, 20, things look good. You had a couple of blips here. We had what looks like some type of isolated incident, could be a positioning issue here. And then things started to rapidly drop off. So the question is, what happened there? One of the things that you can use to also further put some quantitative evaluation behind that is essentially coming in and looking at the gamma matrix. And what I did is essentially captured, this is fraction 1's results for what's called beam 10, or the 4th arc in this particular case, fraction 25, fraction 28, and then fraction 31. And essentially, and you can see this information across all the fractions, but if you look at fraction 1's results with our software, you don't have to go back and recompute with the different criteria. We're giving you preset, predetermined results with different distance to agreements all the way out to 10 millimeters, and same thing with a dose difference or a signal difference from 1% to 10%. So you can actually just visually, without even really looking at the numbers, get an idea of how your treatment is progressing on a per beam basis. And you can see that by 31, this has actually deteriorated quite a bit, which then would lead to an investigation. But if you were going to reestablish some of your criteria, say at fraction 25, it's like at 3%, 3 millimeters, you're down to 91.2%. And then you look at that same result by fraction 28, you can see that you've actually dropped down to 83. In your clinic, maybe you set your threshold at 90, maybe you set it at 95 for a particular case. It's totally customizable based on, the types of cases you treat in your clinic, but it's an easy view to actually see kind of what's taking place so that you know kind of where to set your criteria for particular case types once you've done some of your analysis. So then hot and cold that I've mentioned. So it's a hot-cold gamma, and it's just like it sounds. So hot versus cold, you're going to have higher portal dose in this case. So it's the dose on the actual imager that we are measuring, and then we're going to try to make sense of what that means. So red is going to be higher, blue is going to be lower portal dose. You can also think of this in terms of shorter path length of the beam is going to result in a higher portal dose signal. A longer path length, i.e., it traversed more material, or effective path length, it's going to be colder. And then we've got shorter path length versus longer effective path length. And we'll talk about sort of what that means with some of these results below. So this gets you sort of in the frame of a thought to analyze your cases. So if we look at these two examples, I've got a pelvis case. This is kind of a fixed beam. It could be an APPA for a delivery. It's indicating that it's hot. So the signal on the portal imager is higher than we expected. And then we've got a breast case for tangents, where we've got this area that if we were to look temporally and see this kind of every day across our fractions, it's like if we think, what could be causing the signal to be lower in this particular region than maybe we expect, the hot and cold sort of help us frame sort of what's going on there. So if we have a weight or volume loss, we're going to expect to see a red. So in this particular case, is there something here? Has this patient lost weight? Is there potentially, something in the way that the path length of the beam is now shorter? So it's triggering that. So with these types of cases, we're going to look for basically a weight loss or weight volume, or potentially alignment, because alignment can essentially go either way. If you misalign the patient slightly, you could get a hot signal if the beam passes through less material, or you could get a cold signal if it passes through more material. Same thing with weight or volume gain. You're going to expect to see kind of blue results. And then if we were looking at lungs, and just think fluid, we can't necessarily detect pulmonary edema, but pulmonary edema is one of those things. If it happens between the time of simulation and the course of your treatment, you get fluid in the lungs, you're going to get essentially kind of a cold signal. Same thing would be for a pleural effusion, where you're getting fluid around that chest cavity. And then if you have one of these that opens up, say you had fluid at the time of simulation, and then it resolves, and you've now got more air in the path of the beam, it's going to be hot. Or if you have bolus that is supposed to be present on a beam and it is missing, you're going to get basically a hot result. And potentially, if you have a beam that is supposed to be bolus, no bolus, and then you bolus on a day that is supposed to be no bolus, you will potentially get the opposite result. And then for pelvis cases, and some of this will depend on body habitus, but if you have a patient that is supposed to have a full bladder, or in some cases empty bladder, and they have an extremely full bladder, if it causes the path length of that beam to change, that result is going to be cold. So that's sort of how you would use this hot and cold gamma to frame your investigation or your analysis of these results. And once you sort of put things in buckets for the different areas that you're going to look at, like head and neck, obviously what we're going to be looking at are some of the weight loss, volume loss type situations as those things get hotter. It sort of helps you quickly dispose of these cases and basically make, a recommendation to the physicist, potentially have a conversation with a therapist on alignment, etc. It's a good tool for chart rounds review. Some of our customers use it for that. If they have, cases that aren't setting up well, they'll use both the cone beam CT information as well as the Adaptivo information to go in and sort of have that discussion, because you can see whether or not it's isolated incidents, again, looking at that temporal information across the fractions, or whether it's something systematic that potentially needs to be looked at. So with that stated, we kind of understand the tools. Let's look at an actual case. So this is a case study that sort of drills home some of the points that I was just referring to. This is one of those things, it's kind of a in-your-face case. And this is a very nice case for illustration. It's a right lung and mediastinum, a VMAT or rapid arc case. It has been previously treated, so it had SBRT to a portion of the lung previously, and we are going to be retreating over some of that area. The analysis used in Adaptivo is the predicted mode, so we're using this compared to the actual treatment plan. Then a little more background to go with this. As would be expected, the goal with the planning is to minimize dose wherever possible due to the previous SBRT within the current region and some of those overlapping volumes. And then to complicate matters, this patient did have significant fluid in the right lung during the simulation. And this was the CT that was used for planning. And we'll take a look at that here in just a second. And I would add that this case is courtesy of Brian Pomager. He's one of our users of our software, and he was so gracious to share this case with us. So a little more on the clinical background. You will see that this is a relatively large volume being treated to a fairly high dose. Previously, the SBRT treatment was 7 gray and 5 fractions, so a total 35 gray, and then the current prescription, I think it's for an additional 65.5 gray. The area previously treated was considered an at-risk structure, so there were things contoured in the planning to sort of help minimize overlap in that potential region, and avoid any unacceptable hotspots. So then this view actually shows you, this is what you will see when you first get into our software, these things on the bottom called chiclets. And this is where you can actually see several patients' plans at one time to get kind of an overall view of how things are going. So for this right lung case, you can see, and this is everywhere you see the bar, that is an average fraction, so, or average result, I should say, and this is what you would see up in the top. And essentially, first week of treatment and then an average result, second week of treatment, average result, and so on. And you can see that things were going well until we got to these sort of last 2 weeks of treatment, and then things started to fall off the cliff. And if you look at some of this temporal information, you can see that indeed on certain days things are looking worse than others, and then you get to the point that some of these actually it starts to fill basically the whole treatment area, and some of these are a little worse than others, and it could be related to setup, what have you, and the cone beam CT is basically going to answer some of those questions. So with the hot and cold gamma that we talked about before, with this case, we're getting the red, so this is hotter. So then the question would become, given that it's a lung and given what we were looking at, it's like, what are the potential causes for this? So you could think patient anatomy, tumor regression, potentially weight loss. In this case, the person also has some fluid in their lungs that was mentioned at the time of planning. So with that in mind, we go in to analyze what's potentially causing this. We take a look at our other information in Adaptivo, It also gives us a view where we can get, this is essentially the profiles with the reference. This is the predicted signal on the panel versus green, the actual measured signal. So with that measured signal, we can see that it's actually higher, which correlates with the gamma, hot gamma that we were seeing versus cold. So the signal's higher. This gives you some idea of the amplitude or magnitude of that disagreement. And after you use the software for a bit, you can actually get a pretty good feel based on the different anatomical locations when you get to a point that you're probably going to need to address basically some of this disagreement. So with this, you can see that it had a fairly significant deviation between what is expected or predicted versus what was measured. So then the question becomes, okay, do we need to do anything with this? So to aid in some of this, we give you basically reports across all of the fractions. So the physician gets some information on what has taken place up to this point. So we kind of know that during this last week or so, things have taken a turn and we've got a downward trend. So then we go in to essentially analyze the case. And you would do this essentially, if we go back, you're going to want to do this when you get the alerts and you notice that there are potential changes. So you get the email alert for a potential failure on a fraction. This is kind of what you're going to do. Come in, go to ARIA, and then you're going to assess essentially that planning CT versus in the right lower corner on the images Brian supplied for us, the treatment or cone beam CT, and you can see that it has actually the patient outline in green. And if we look at that as expected in the planning CT, it matches pretty well. So you can actually see that this patient, in addition to having some other issues as well, has lost a little bit of weight. So this is going to be, another path length change. And then if we look at the tumor, or the area of the tumor, I should say, you can see what was contoured, and you can see that it is also starting to resolve a bit. And then this area in the lower right, where there was actually fluid, we can actually see that that is starting to dissipate. This, with an ARC-based treatment, is also going to lead to path length changes. And then if you look at the overlay of sort of the planning CT and this treatment cone beam CT, you can sort of get the differences, but it's pretty obvious looking at these. So with this information, you can give the physician kind of, here's what's taken place so far in Adaptivo, and this is where we are. And then the physician can make a determination on whether or not they need to replan or not. So in summary, Adaptivo alerted the staff that there were significant changes basically in the results. The investigation revealed that the patient's anatomy, including weight loss, tumor regression, and a significant decrease in the fluid in the right lung, had taken place based on the information provided by Adaptivo. The physician discontinued the initial plan early. They did re-CT, replanned the patient in the way of a boost. And based on the replanning, the physician decided to sort of up the dose from a planned 2.5 gray per fraction to 3 gray for those remaining fractions because the volume was a little bit smaller based on some of their composite information at the time of planning. Physician felt it was safe to go this route. So the end result is a significant reduction in the treatment volume, increase in the tumor dose, and a reduction in the dose in normal tissue versus continuing as planned. So with that, I just wanted to drill home a couple of points here. So with Adaptivo, aside from the automatic processing, so again, you don't have to export anything each day. It's automatically going to detect that a delivery has taken place for a patient, and it's going to process that information. So then the question becomes, how do you use this stuff in your clinic? So in the software, if you chose just to log in each day, there is an area that has active alerts, and it is going to show you essentially for each patient the alerts that are available. And the numbers here are just for example. I think if you were doing this clinically, you would like to only see one for essentially each patient. But again, these are demos for us to kind of show what the software can do. But if you click on one of the patient IDs, it's going to give you a drop down. It'll actually give you a link. You can navigate to the fraction and review the result. So you could actually use the software this way, where some of our customers, basically they'll come into the software several times a day just to check to see if there are any alerts on the patients. And they do this periodically throughout the day. Others choose to basically use our notifications, where you can actually subscribe to any events that you want. And you can see this is just for the plans. There's actually a ton of notifications that you could subscribe for outside of plans. But let's just talk the clinical aspect of this. So in this example, I've essentially turned on that I want an email if a fraction result fails. So every time I get any fraction result for a patient, it's going to send me an email. I can get an INVIVO fraction result in the fail region. I can get average result in the fail region, and I can do the same thing for pretreatment QA. You could, in theory, go check off all of these things and you get a lot of alerts. This is also an in-app message. Say you only have certain patients that you have been assigned to follow. You can actually set this stuff up. If there's more than one clinic that you're following, you can actually get a notification based on the plans for a particular patient. So you come in and you look at your in-app notifications and only deal with the patients that you essentially want to subscribe to. So again, if you want a lot of emails, you can come in and make this work for you. If you want a few emails, maybe you only come in and only pick one or two of these things to turn on. But again, it's very flexible. It's up to you to make the software work for you, but it will definitely fit basically any workflow as far as how you want to use this, because we do have users that basically figure out based on their clinic essentially what they want to be notified on, and they don't even come into the software until they get a notification. We have others that use it throughout the day. So it's very flexible, and it's based on basically your preferences and sort of what your clinic policies are. So with that, I want to give you a couple of takeaways, and it's essentially we covered basically the modules in Adaptivo. And we have pretreatment QA, the INVIVO, which we talked about today, as well as the adaptive module. The treatment machines that are currently supported are those Varian sort of C-arm Linacs, your TrueBeams, IXs, etc. What are the basic capabilities of the INVIVO portion of Adaptivo? So it's going to alert you to those path length changes. So the beam's going to traverse, or it's transit dosimetry of the patient. When that beam passes through, based on your reference or the treatment plan, it's going to alert you when there's a change. And then your ancillary investigation is going to help you go investigate basically whether there's something there that you need to particularly take action on or not. And that gets to the types of issues that Adaptivo can detect. So those things around weight loss, weight gain, volume changes, alignment issues, potentially bolus, no bolus type of thing. That is where it's going to be very helpful. And a lot of our customers have found that when they initially install the software, their patient alignments become something for certain case types that they discover things that they hadn't noticed before. And the software has actually helped them sort of zero in on some clinical protocols or set up protocols to maybe make those a little more robust, or it potentially identified an issue with planning that they changed some of their steps. And then where does Adaptivo fit into the radiation therapy process? So the pretreatment module obviously fits into that pretreatment category, and then the INVIVO and adaptive module sort of fit in that downstream once the fraction has been delivered, we help you analyze, and it gives you sort of that safety net of, was the treatment delivered as intended? Was it delivered according to the reference you're comparing it to, be that the treatment plan or one of your other fractions? So then I want to put a plug in for a couple other products that fit really nicely with Adaptivo. So Linac View is essentially a view of your machine on every fraction. So it's a log file based analysis, and where in Adaptivo, we're looking at stuff in the patient space when we're in the treatment QA side. Linac View is actually going to give you a view inside the machine so you can help rule out machine issue versus patient space issue. And then I Am Sure 3D is another software package. This is a second check software package, so checking your treatment plan, but it is a Monte Carlo simulation, so it's actually going to give you the ability to also do QA on your planning system and your beam models, and you may discover some things that you didn't quite realize were there. But combine these with Linac View, Adaptivo, I Am Sure 3D, you've got a complementary solution package to basically give you comfort that basically your machine is working as it's supposed to, your treatment plan matches basically your beam model, and your treatment deliveries basically are on target and progressing as you intended. So with that stated, I'll kind of close this and see if there are any questions. And thank you very much. I appreciate your time and your patience.